So this next condition we're going to talk about is very prone to runners and cyclists. We're going to be talking about the IT band today. What is the IT band syndrome? What does it do? All that fun stuff. Now, what it is, and typically where patients are going to experiencing pain, is closer to the knee where the IT band inserts, where it kind of travels down to. Now, like I mentioned earlier, when you're doing kind of some higher endurance sporting events, you're going to start to see this irritation because that IT band, when it's utilized and it's used, it puts a little stress on some of the tissue closer to the insertion, and that's where we're going to start to see the pain. Now, IT band syndrome is about 1/4 of every lower extremity injury, so it's a very common condition, as well as we see about 12% of all runners across their kind of running career has some form of an IT band syndrome at some point. So it's also very common in basketball and weightlifting and cycling, and like I previously mentioned, running as well. Now, we typically see this injury on runners specifically if they're running around like a track that may have some form of like an embankment, as well as we might see this in people that have, biked massive amounts of miles, someone that's kind of in this like single leg stance, but the knee is kind of going in flexion and extension a good bit. So that's where you're going to start to see that stress being put on that IT band a lot. Now, we also see IT band syndrome when someone has kind of a lack of balance of musculature, when the muscles on the front side of the hip and the back side of the hip are just kind of not working together. There's kind of an imbalance. You're seeing kind of a muscle pull that's a little bit stronger one way than the other. So that's something that we would typically see in an IT band syndrome. So typically when a patient will present to our office, we're going to see the patient have some form of complaint. And it's going to be just kind of local to where like I said earlier, where the IT band kind of inserts or where it kind of goes down the side of the leg. Typically, you're going to have pain, upon palpation. If we're pushing on it, it's going to be kind of sore and tender. In some cases, you may even have the IT band flare up while doing the activity. So, you may not be experiencing it in the office currently, but, if we get you outside and run a little bit or we do some activities in the gym, you might see that pain kind of flare up, and that will also kind of help us determine, what's going on. Now, in order to fix this condition, they say about 44% of people with IT band syndrome see improvement in about 2 months, as well as about 95% of people resolve this condition in 6 months. Now, that's a pretty big gap, and 2 months to 6 months is kind of a long time to recover. A lot of research is out kind of nowadays saying about 4 to 6 weeks if we're utilizing conservative care. So that kind of helps me move into the next phases. We're going to start working on the IT band, and it typically responds really well to, a lot of soft tissue modalities. So we're doing some instrument-assisted soft tissue manipulation. We're doing some cupping. We're doing some dry needling. We're also doing some myofascial release with our hands. Now, that 4 to 6 week mark I talked about previously mentioned, this is where we're going to really see the best improvement, is when we start utilizing hip strengthening exercises. Now, there's some muscles that kind of help move the hip outward as well as help stabilize and hold it in place when we're doing all these activities. And that's where patients are going to tend to see full resolution of this condition in about 4 to 6 weeks. That is what we're going to be aiming for here in the office, is trying to speed up this recovery period with utilizing all these other techniques and all these different soft tissue modalities. And that's where we're going to see the most improvement for this condition. So, if you're getting out into the fall weather, you're starting to run a lot more, starting to cycle a lot more, you're starting to kind of see this IT band flare up, we'd love to help. We'd love to take a look at it. We'd love to kind of give you a nice little diagnosis. We typically can get you in pretty quick to see one of the docs. So give the office a call at 513-463-3011, and we will see you soon. Thanks.